Begin right now. Welcome, this is David Lee from Prevent Connect, and welcome to today's Prevent Connect web conference, Men of Color and Community Trauma Prevention, what links sexual and domestic violence efforts to trauma and prevention. It's a pleasure to see so many of you joining throughout the country to be able to do this, and we're learning about the different weather. It is cold and windy in Silver Springs, Maryland, but yet partly cloudy in Greenville, Mississippi. So great to be able to have so many of you joining us today for today's Prevent Connect web conference. Prevent Connect is, we have information about us. You have all registered for this website at our website. If you want to contact us, you can contact us by email. We do have wonderful e-learning programs that are available at our learn.preventconnect. We also have our own Prevent Connect Wiki, which is a wiki like Wikipedia, but it's all on prevention of sexual and domestic violence. I encourage you to visit that. For your old school, we have an email group, and you can join the email group. And we also want you to friend us on Facebook, like us on Twitter, and all the other means of social media. You can even get our podcasts on iTunes. A little bit about how to use the technology that we have here today. The first thing I want people to do is to raise their hand. The way you do that is look at my picture on the far left, and there's a little hand, and underneath it, it says My Status. Can everyone please raise their hand? I would appreciate that if you can raise your hand. Thank you very much. Let's go have as many of you as possible to raise your hand. I only have 33 of you. Less than half of you have done that. One of the ways that we at Prevent Connect make our web conferences interesting is about being engaging. We want to draw from all of you, so we want to be able to get that information there. So thank you much. We also have a text chat and private chat. They've actually changed the text chat from when I did my screenshot a little bit. It's now, it should be on the right-hand side. You write a message here, and then you press return to be able to then or enter on your keyboard to get messages, and I see that you've been able to do that. We do have slides for today's presentation. I did two different versions of the slides. One version of the slides are one slide per page, and one's going to be 3 per pages for notes. If you want to do that, we have copies of the slides available on the Prevent Connect website. I am just posting the address right now where you can download a copy of those slides. I do want to ask a couple questions of the audience so we can know who is joining us today. So my first question that I want to ask should appear on your screen, and this is, have you attended a web conference before? And no, this is the first time you've ever been on any web conference. Or, yes, but this is the first time you've been on a web conference before, but the first time attending a Prevent Connect web conference. And then 30 is you've gone to 1 or 2 previous Prevent Connect web conferences. And the final option is you've attended 3 or more. And so let's go ahead, and not all of you have voted. I see that's going on, and great to be able to see all of you voting here. And I'm going to share the results for you all to be able to see this. And what you'll see is that 10% of you have not been on a web conference before and are joining us. Another 15% of you are new, so about a quarter of our audience are new to Prevent Connect. But this also means that a wide variety of you have gone to 1 or 2, and we can see that 29% of you have gone to 3 or more. What Prevent Connect's power is by bringing together prevention practitioners throughout the country and the world to be able to work together, to be able to share information with each other. So thank you for doing that. I have another question that I want to ask. This next question is, what best describes your organization or agency? And I've got a long laundry list here. So pick the one that best describes you. And let's see, are you with a sexual assault agency or coalition, or domestic violence agency or coalition? Are you with a dual sexual assault domestic violence education? Are you with education, college, university, or education K through 12? Are you with a health department on a state, territorial, federal level? Are you with a tribal organization? Are you with an alcohol and other drugs? And you can see a long list. And let's go ahead and I will share the results and and read some of the highlights. So what we've done here is gone over, and we have 18% are from dual agencies, 15% are from sexual assault agencies. The next biggest one is 8% from domestic violence agencies. We have 6% from community-based organizations, 3% from health departments, 7% from colleges and universities, and a handful of others. So thank you for sharing. We can see that this is who is joining us at today's web conference. I'm going to close the polling now and have that disappear. We do have the phone. You are all on the phone. We keep your phone lines muted except for our speakers. We want you to ask your questions best through the text chat, and we'll be able to do that. We do have closed captioning. Our partners at Aberdeen Captioning are doing the captioning, and if you want to do that, you can click on the captioning button in the upper right-hand corner of your screen and be able to see the captioning and thank them for their service working with us. We do have web conference guidelines. It's basically be respectful and honor where we're in our conversation. We want a lot of people sharing in the text chat, but if it's a topic that's sort of extraneous or personal connections, take it to the private chat. You can do it by just clicking on private. You can click on someone else's name and share information with other peers. So it's a way you can join us. If you need help, you can always send a private text chat to myself or any of the moderators. You can please send a prayer, or you can also call iLink Technical Assistance if you're having trouble getting on the web conference at 800-799-4510. That is 800-799-4510. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the United States government, the CDC, or CalCASA. So Prevent Connect does focus on domestic violence, intimate partner violence, and sexual violence. We look at violence across the lifespan, from children to elders. The Prevent is about preventing violence before it starts in the first place, thus an emphasis on primary prevention of what we talk about, and we make connections. We make a connect to other forms of violence and oppression, and very importantly, we connect to other prevention practitioners, and that's what we try to be able to do during our web conferences. I'm really glad that so many of you are joining us for this important topic today, which I think is very timely. We have a wide variety of web conferences. As you can see, this is our schedule for the theme this year in 2015, Making Connections, Honoring Communities. We've already had, this is almost in the middle of our series for the year. There'll be a few extras that will come in. I do encourage you, we'll be opening up sort of our introductory session soon called Foundations to the Future of Prevention Approach to Sexual and Domestic Violence. They'll be looking at child-focused approaches, joint strategies, and increasing investment in sustainability. You can see later on. We encourage you to join us. It's a great opportunity for us to be able to do things. We also have, for our previous sessions, recordings of those sessions available. This is a way that you can be able to connect and learn with each other about the work that we're doing. So with that, I am really happy to hand the podium over to my colleagues at Prevention Institute, and I'm doing this to Annie Lyles and Tanya. And Tanya, we've actually met in person for the first time. I'm sitting at Prevention Institute right now, but you're going to have to help me with your last name.
Rovira Osterwalder.
I'm going to get it down, but we do it. So welcome. It's wonderful to have you here. And so I don't know which one of you takes it first.
That is going to be me, David. Wonderful. So there I am. Hi, everyone. This is Annie. Welcome. Welcome back for many of you. I always love that 30% of our audience is really not audience, but community. That's what makes Prevent Connect special. And those of you that have hit 2 or more, welcome to community. And those of you, 25% of you that are brand new, we're so glad you're here. We hope the information is going to be valuable, and invite you to come join us more often if there's more topics kind of to your liking here. So I also want to introduce Tanya, this is her first co-facilitation with us today, and I'll go back to those objectives in a second. Tanya works here at Prevention Institute with me. She's also a manager. She manages our local, national, and international, a growing area for us to work in health equity, injury, trauma prevention, and violence prevention. So you can see why I'm so pleased to have her expertise with us. Her educational background is in counseling, and she comes to us from San Diego County, which is a great place to be from, since Ashley from CalCASA and myself are also from San Diego County profession. So wonderful, Tanya. It's so wonderful to have you here.
Thank you.
Great. We also want to introduce Alexis and Will, who are there behind the scenes. Alexis, Will, hi.
Hi there.
Hello. They are making this all happen behind the scenes with David and the CalCASA team. So as you write questions in, they will be able to answer you around the technology as we move forward. So big thanks to them for getting this all set up today. Just a reminder, when we talk about prevention here at Prevent Connect, we are talking about primary prevention. We are looking at systemic processes and how they promote healthy environments and behaviors to reduce the likelihood that something happens. We're talking about taking action before sexual and domestic violence occurs. And we know primary, secondary, tertiary doesn't always just roll off the tongue eloquently. So the young people in Philadelphia, you've probably heard me say this before, helped us rename that primary, secondary, and tertiary prevention to upfront, in the thick, and in the aftermath. So today we're really focused on upfront strategies, approaches that take place before violence has occurred. Our good friend in Minnesota, Patty Wetterling, inspired me with her comments. This is really about equity and respect for all, and how do we get there? And that's really the premise of prevention and why I'm so excited to explore this topic today. You know, things like in the thick, screening, juvenile justice policy, they are really, really important to this field, but also to, this topic today. But that is not the focus of our work. Our work is really thinking today about these upfront strategies. What does everyone need to grow and thrive? And very specifically, we're looking at this issue of men of color and community trauma prevention. And, what really links sexual and domestic violence efforts to trauma prevention? We do have a formal agenda here. We're going to kind of define the concept of community trauma, explore its value and prevention, and then really have a good, robust discussion and some time to really think through what is needed to support men of color through this. We'll look at approaches, foster shared priorities, and strategies. We have some very specific tools and resources to share and some very specific ideas for you today. So we'll be doing some very concrete work along with thinking about the approach. I'll take a breath here. I'm really personally excited. This is a topic that's near and dear to our heart at Prevention Institute, and it's so great to have folks and partners at CalCASA and funders like CDC that are supportive of thinking through these kind of questions that are actually really difficult. And I saw Mira is in the audience today, Mira Youssef at Monsoon United Asia Women. She doesn't know this, but she's actually the one that kind of seeded this web conference and the thought about it 4, maybe 5 years ago when she was sharing her work, and she talked a lot about who's left out when we're doing family-serving agencies doing prevention. And she said, in general, it's men. It's men, it's fathers, and it's adolescents that we tend to leave out of family-serving agencies. And I think this field of sexual and domestic violence has really figured that out. And one of the most popular strategies now based on the National Sexual NSDRC. David, what's the acronym? I just forgot it. The good word there.
The NSPIS.
No, not the NSPIS. It's NSDRC.
The Resource Center.
Yes, our good partners. So they did this great work thinking about what are the most popular strategies, and one of them is to mobilize men and boys. And so this field, I think, gets that. We've been leaving someone out, and mobilizing men and boys are important. And at Prevent Connect, that's a question that's very popular that folks have been thinking a lot about. And then this summer, as the kind of movement around Black Lives Matter really came up, that had my attention for a lot of reasons. And while Black Lives Matter is really focused on police brutality and justice, their 5th of their 5 demands is about reinvestment in community, about jobs, about housing, about schools. And there's so much overlap to the work we're doing in sexual and domestic violence. This is one of the kind of participatory posts they had at one of their events. And it really struck me how much overlap there is. Before I die, I want to be free, be treated equally, be seen as human, and be the change I want to see. And I said, this is the conversation. The theme this whole season for Prevent Connect is making connections, and this just seemed really right for that connection. I do want to share one other piece of information with you, and that's this, and that this isn't an easy connection. I think one of the things that this field does best, and one of the things we explore here at Prevent Connect is thinking about how environments impact behavior, how racism, sexism intersect. And one of the things kind of really impacting trauma and Black Lives Matter is this concept of innocence. There's a study that came out, and I don't think I've ever read the study without crying. No matter how many times I read it, it does make me cry. So just a warning for you on that. We'll put a link to it. But the study really examines how Black boys are viewed. And they interviewed 176 police officers and 264 white female undergraduates. Two very different demographics, but they had the same results. And what they found is for Black boys, starting after 10 years old or after 9 years old, as soon as they hit 10, they lose the protection afforded by being kind of assumed a childhood innocence, and they're aged. And so what happens is folks assume they're older. They give them more responsibility for their behavior than they would a child of a different race. And so there's this whole application to this in this research. There's so much here. I definitely recommend looking at it when you have a moment. But as we age these children prematurely, what we do is we take away their innocence. And when it comes to prevention, we take away kind of who is deserving of service. And I think in the field of sexual domestic violence, the reason I wanted to have this conversation is you all have expertise making the case for prevention, changing the way victims are talked about and viewed as deserving, and really centering the discussion on policy and fighting ism, which I think are all really important aspects of understanding how it is that we can acknowledge Black Lives Matter. And those really have some of the same goals we have here. The slide is not meant to be offensive. This is a Google search I did day before yesterday, of the word innocence. And frankly, it looks like crazy, like white propaganda. But this is, when you put in innocence in Google, this is what comes out. So it's not just the police officers and the white undergraduates that are framing innocence in terms of whiteness. And it's a really important question to consider when we're thinking about this work. So that's why we're here today. That's why we're exploring the connections. I think our field has some things to learn. Our field has some things, kind of expertise that can be offered, and we're going to identify joint strategies, shared opportunities. And what I'd like to do before we move further is ask you why you're here today. What are you most interested in learning about? And that way, as we kind of turn over to our guests and allow them to chat in and share their experience and we share ours, we'll be able to frame it in the areas that you're most interested in. So let's go ahead and use that text chat.
So, Annie, this is a really great question. I'd just love to hear from you. So go ahead and write in the text chat, what are you most interested in learning about today? We want to hear from you all because we believe that the best learning is going to come from us together. So I know people at Annie are writing about, so I'm now seeing that some people are starting to write in police violence, and I think it's really an important place for us to think about those linkages as we're looking at our sexual and domestic violence prevention. There was just the Color of Violence conference that Insight put on last week, which was really looking at some of those issues. Go ahead, Annie.
Yeah. Well, I was just going to say, when we throw the term out there, police violence, I just want to remind folks it's the prevention of. So what can we do in our environment and in our policies, in our practices, that would make police violence less likely to occur? That's our charge here at Prevent Connect. I think there's a lot of work to be done after the fact in the thick, but our focus, I just want to remind folks, is those kind of upfront environmental change strategies. So lots of great things coming in. Tanya, anything catching your eye?
I'm looking at somebody put voice of men of color and gender issues, engagement of color and prevention.
I see Kalila, our good friend in Louisville, is chiming in with addressing trauma in our communities as a way to stop violence against women. We know that there are a lot of interconnected risk factors here.
And Hilda also got some votes here with talking about connecting men's experiences of oppression to their perpetration of violence as a vehicle for prevention. And I saw some other people supporting that. I love Natalie talks about reframing the issue of sexual violence to be more intersectional across identities.
I love that. I think that is, again, one of the things that Prevent Connect. We're willing to sit in some of these complex places, and the concept of intersectionality. So how does your experience with one type of identity impact the way you experience another identity? So if you're a woman, how you experience being a woman is impacted if you're a black woman or a rich woman or a poor woman. We can sit in that complexity here. And Jenny puts it out there as well. That's great. All right, well, this is really helpful. I think it's a topic that we're going to keep looking at Prevention Institute, and we will use the text chat to help refine our thinking and kind of push this move forward. So feel free to kind of put in, keep coming with us. I see Lindsay put us a lifelong comment, so that's fine too. And I think that's something that, keep it all going. And Wivette summed it up for us, all of the above. Well done, Wivette, well done. All right. Well, without further ado, and we will keep an eye on the text chat as we keep going, I want to introduce our two guests today, Patricia McManus and Kenny Green. Welcome, both of you.
Thank you for having us.
Yeah, let me give you a formal introduction here. Patricia Taylor McManus is the co-founder and president-CEO of the Black Health Coalition of Wisconsin, which is known as the BHCW. She is a community-based health advocacy organization, and Patricia is also a clinical assistant professor at the Medical College of Wisconsin, Department of Pediatrics. The organization has completed research on resilience in African American families, which has been presented across the country. It's one of the reasons we're really excited to have her today. And Patricia is a national consultant in the areas of life course, resiliency, domestic violence, infant mortality, and historical trauma in African American communities. So you can imagine how exciting it was when we heard Patricia was going to be able to join us. Welcome, Patricia.
Thank you very much.
Yeah, and on the other side of the country, we've got Kenny Green. He is the program manager at the Gang Intervention Department at Toberhood Neighborhood Center, which has been serving the community since 1903. Not Kenny, but the organization he's working at. Toberman offers a holistic approach to social services through three main areas of programming: Toberman Academy for Youth, the Family Resource Center, and Gang Intervention. Kenny has dedicated his life to working with youth and young adults in the Harbor area, which is the west side there, southwest side of Los Angeles County. And for the last 18 years, he has worked with Toberman's Gang Intervention program with a track record of working with multi-ethnic groups. His years of training give him a theoretical and practical understanding of the best practices of both the medical model, revisionist ethnic cultural competency model, as well as possessing a theoretical, practical understanding of the psychosocial concept of alternation. So Kenny is one of the people that really got me thinking about these links. I got to hear him speak in person in May of last year. So you can see we're able to bring together a lot of folks that have been thinking about this issue for quite a while now, and we're so pleased to have you here. Welcome, Kenny.
Thank you very much for having me.
Yeah. Let me start with you, Kenny. Any thoughts as we got the conversation started today? What's sticking out for you?
Oh, as I look down the chat, I mean, everything is just really, really fascinating where people, want to kind of address this issue. Issue is a very big issue in our society, and it's not only, the whole violence component is something that we really need to address. And I'm just happy to be here to share whatever I can and also to learn from everybody that's here.
Awesome. Thank you. Patricia, anything sticking out to you as we start the conversation today? What's getting you interested and excited?
Well, I think, as Kenny said, I'm looking at the chats and some of the comments and questions, and I think it's really good that these kind of concerns are raised, because sometimes they're out there and you think people don't know they're there and they're asking. And anytime you ask, that really means that you want to learn. And, we're adult learners, which means that we're always learning. And so I think Kenny says, too, I learn as much as I can give, as much information as I can, and how we can do things. So I'm excited.
Fantastic. Kenny, we had a question for you about what city are you coming from? And I know that that's a complex one for you because you cover a couple cities, but I thought I'd let you answer.
Well, here we're at Toberman is located in San Pedro, which is the southern tip of the Los Angeles County. So we're right between Long Beach and Torrance, if you're familiar with Los Angeles, but we're just right south of South Central. So we are in Los Angeles, the city of Los Angeles, actually. We're in the beach area, so we get that great weather out here as well.
Yes. Quit bragging about that weather, Kenny. Hey, well, why don't you start us off, Kenny? Tell us a little bit about, your background is in gang intervention. Why did you get, interested in thinking about domestic violence when your background really is more focused on kind of men of color and preventing community violence?
Well, it's interesting. I came on to Toberman about 18 years ago strictly to deal with gangs. So me coming in here, okay, let's put out some fires. If there's an incident, there's a shooting, any kind of violence, we were the violence interrupters. So if something happened in Wilmington, let's say, I would respond and just put out the fire. Just talk people down. Try to negotiate some kind of peaceful resolution. So as and gang intervention has gone through so many different kind of evolutions, so many different kind of paradigm shifts. So when you brought up so that's what we're doing. Back in a few years ago, I was blessed to interact with a councilman we had here by the name of Tony Cardenas. He chaired the gang intervention, the gang violence youth development committee for the city of Los Angeles. And he was tasked to kind of look at the gang violence in the city of Los Angeles. Out of that committee that he headed, he put together ad hoc, which basically put together something which called as a community-based gang intervention model, which we kind of base our work on now in the city of Los Angeles. And it looks at gang intervention at a two-prong approach. The first prong is all the public, safety stuff like, the street mediation, the violence interruption, the community engagement, the neighborhood interfacing, rumor control, and everything else that has to do with the public. Prong two is basically all the individualized plans that we have to develop for individuals that we deal with. And, that's mental health, that's, rec stuff, that's tattoo removal, anything that has to do with redirecting lives. And as, I kind of got my mind wrapped around just the whole trying to change a person's life, about 6 years ago, I was blessed to get invited to a group called the Domestic Violence Gang Nexus in Los Angeles, which was spearheaded by the city attorney Eve Sheedy. She's a prosecutor, and she got together practitioners from every walk of life that had to deal with domestic violence or gang violence. And 6 years later, I'm like really sold on it. Matter of fact, I've learned so much from those group on how I can deal with violence on a whole kind of different perspective. And I shared a story with you, Ann, and you want me to tell it? Well, what happened was, there was a shooting, and I had to respond to it. And it was a young man I knew the whole family, and responded to it. Now, 10 years ago, I would have got, when I ran across him, I said, well, I need to talk to you. No, Kenny, I need to talk to you. I want to talk about what's going on with this shooting. And so 10 years ago, I would have just dealt with the shooting, and wherever he wanted to go, I just wanted to do the shooting. Well, I got him in my car, and we started talking. And from our conversation, he led into an area where he was talking about how he was molested when he was 6 years old. 10 years ago, I would have said, you know what, I don't want to deal with that right now. That is something I don't want to deal with. I want to talk about this shooting. Why'd you do the shooting? And that was 10 years ago. Today, learning what I learned about all different kinds of trauma, getting educated from, you know, a lot of my DV partners and Eve about, you know, the trauma and how it affects folks, I had to sit and listen to it. Well, as he was telling me this, he's 40 years old. So he was molested by his uncle at the age of 6. I said, wow,
right.
Okay. Listening to it, listening to the trauma, now I understood why all his relationships were very violent. You know, why, you know, this man had lived 34 years without even having this trauma addressed. And then the other things started popping in my head. Okay, his mom, you know, that's her brother. I knew the whole family. So he's thinking, why didn't my mother protect me from her brother? Or why did my father protect me from my uncle? Now him going into, you know, family functions as a little kid, seeing this man that molested him, all this kind of stuff is like really, really made him who he is. And so understanding the trauma, that helped me get him, you know, talking with them, kind of massaging it, so I could get him ready for a warm handoff to somebody that could deal with that trauma. That was 3 years ago. That was 3 years into knowing Eve and the rest of the DV community, helped me to deal with a very violent person on the streets that's shooting other gang members, but it also helped me, okay, you know, get this guy in a good place, deal with all this other stuff that he had carried for 34 years.
Well, so for me,
go ahead.
Yeah, when you told that story, Kenny, I mean, I think for me, you know, Eve is on this call, so shout out to Eve and the DV Nexus, the DV Gang Nexus Committee here in Los Angeles County, and the relationships folks have built there to really break down silos, because the real kind of epiphany to me in that story is that you were prepared to think through some of those dynamics of sexual assault and how it relates later on to misogyny and masculinity and all of those things, and make those connections. And, you know, that's where we're kind of starting today. And I also want to bring Patricia into the discussion. Patricia really brings some of those protective factors and the ideas of resilience. And I'm seeing in the text chat some of the resilience factors coming from the Pacific Islander, and I think it was Tongan community. And I wanted to lift up 2 questions, one from Samuel and one from Kathleen, and I thought, Patricia, maybe you could answer them based on your experience in Wisconsin looking at resilience. One of the questions, Kathleen said, you know, they have a local population of black men, but there's a significant college population for other states. And so she was thinking about, you know, given that there's a little different culture there, you know, what might be some things to do? And Samuel's question, I think, also goes to this. He said, we talk a lot about educating black America, but as a black man, I believe the white men of America really need to be educated about black America and not feed into the stereotypes. I thought that really kind of lent to some of the conversations we've had, Patricia. Maybe you could talk about those 2 aspects as you talk about resilience.
Oh, thanks. Yeah, I absolutely. One of the things I think from I think all the way back to looking at beginning to address a community, a lot of people hear the term place matters, and I think that it's so important for people to kind of remember the place does matter, exactly where, not only place but time. There's a lot being discussed now around looking at life course, and sometimes people equate life course with lifespan, but it's not the same thing. It really looks all the way back in history, and you know, you've heard the term that people, if you do the same thing, you do and repeat it, you don't learn. And many things in our country we've not learned about how to work with populations that are different. I mean, we one hand say we're all Americans and we're the same and our culture is the same, but there's a very big difference in how people live their daily lives and the narrative that's written about that. And that's what got me to really looking at the whole issue of resilience in African American families, because you hear all the problems in African American families, and a lot of those are defined by many practitioners or people who work in the agencies who most time are not like the families that they're working with, or the individual males, or the children. And sometimes you may have black people that are working with them, to be fairly honest, though, but they haven't kind of checked themselves. They can be just as detrimental, and maybe more so than other people. But the point is, how do you look at populations of people, and what do you think about them when you look at them? And sometimes it's very It's very, covert. You may not even know what you think. You think it's fine, but how you operate sends a different story. And children from an early age, all the way up, can pick up those signs about what you really think about me. And what I wanted to do was get out there and start talking in terms of rather always identifying. We got enough information on the problems and the pathologies and what people do, but what about the resiliency in these families that makes them, for African Americans, to still be here in this country? So it had to be there. It's not something that you put into somebody. I heard somebody say that once, but it's not. All people have it. Even our research showed that we start out by asking agencies to recommend families, and gave them definitions of resilient and non-resilient, and so that dichotomous way of looking at stuff. But what we found out was that it's really much more of a continuum of which individuals and families kind of float in a line. And one of the things is that depending on the many traumas that happen within the family or with the individual, that resiliency may be low, but it's still there. And so what we do, we like to then, instead of, and certainly from a public health standpoint, people look at risk. But instead of always, and trying to reduce risk, we like to look at increasing the protective factors that people have. That's another way of doing it, and actually it's been shown to be much more long-standing working with populations of people, individuals. If you help them increase their protective factors, and you identify those and they're different from different populations, but you identify who that is for African Americans. One thing that Life Course talks about is the fact that if you look at different cohorts of people, you may look at African Americans that were alive during World War II, but whether they lived in the rural South or whether they lived in the North, or whether they lived in the East Coast or West Coast, very different how their life trajectories have taken. And so a lot of times, and that's why I said place matters in terms of how you work really with populations. But then we also begin to look and say, okay, so what are the resiliency factors that people have? And we found that many times, especially, and we're not really good at that in America, of defining those kinds of things, because we're, quote, all supposed to be Americans. And sometimes we say, oh, well, we can, Latino people, they at least they speak Spanish, so that's what their culture is. Speaking Spanish is not all their culture is. It's much more than that. African Americans, we may speak Ebonics every once in a while. I go there, but they don't think we even have a language, which relates to they don't even have a culture. So when we work with them and how we're trained to work with them, usually is very flawed, because it really does not get to the essence of where people are. Also, when you're dealing with trying to increase somebody's capacity, one of the things I was in a discussion today about that, and that's this term empowerment. Many practitioners use the term, we want to empower these people. Well, empowerment is an intrinsic value. You can't really empower anybody, because you're saying, I got the power, and I'm going to help you get yours or give you mine. And literally, people do have the ability to, what makes more sense, especially on prevention, since we're talking about, is working with people, number one, to believe that they, in fact, have capacity and have resiliency and ability to do it. And then our job becomes to help them find that and use that, and for them to, empowerment being an intrinsic factor, that people then begin to empower themselves. That's the only thing that's going to be actually long-lasting. If we as professionals think that we are the ones that are going to empower people, we give them what we think they need rather than what they really need. And that's been a major flaw in a lot of the programs that's been established, that it's built on really a kind of flawed capacity of thinking that the people I work with, they're so damaged they can't really provide anything themselves. And again, I know that is not everybody, so don't start chatting and writing me up on already, because I'm not saying everybody. But I'm saying the overall way that we have looked at things, unfortunately, many times, that is what happens, and we don't go and ask people, well, what do they want? What makes sense to them? The question about having a small local group versus a university. There are many commonalities among the groups, but there are also many differences based on, again, where they are. The best way to do that is to ask people what they want and not make the assumption that they don't know. Sometimes, and talking to people a lot of times people will tell me, well, I kind of tell them when they ask me questions like that, I just tell them what they want to hear, because if I say something else, then, they'll probably have me written up and send me for therapy or something because they won't understand what I mean. They don't take time to understand who I am and what my population is. And so that we're not, in our educational process, in our professional educational process, we oftentimes are not, we don't move to that. We come out thinking that we've got this piece of paper that kind of shows us, that tells what we should be doing. And that's a major flaw. So
I think
go ahead.
Let me jump in. I think we really explored that last session, and maybe David can put in a link to that. Is how do we go from being educators to listeners and to facilitators? What does that look like as an organization? We go from people that are there to teach versus people that are there to support or facilitate. I think what you said is absolutely resonating with the audience is folks have capacity, they have the resilience. It's about using our prevention abilities to have folks be part of the solution and define the problem and define the solution. And I think that's the charge and kind of the overlap we have here today is thinking about how exactly we do that. Let me just share some approaches that Prevention Institute has kind of concretized that really echo how we start doing that as a field. And I think to some of the comments here in the text chat that, it's not just in African American families, it's in all different types of families and all different types of communities. We're looking at building the resilience of a community, of a family. We're not just at that individual level. We just finished a large landscape analysis, and that's one of the things we wanted to start looking at. This was about mental health and well-being for men and boys in the U.S., and Tanya reminded me so eloquently about the actual definition of mental health. So Tanya, I'll let you jump in here.
Yes, thank you, Annie. And many times when we hear mental health, our thoughts shift to pathology, abnormal, or not typical behavior. And I think in order to redefine the narrative and the dialogue, we need to really look at what is the definition of mental health. So according to the World Health Organization, mental health is a state of well-being in which every individual realizes his or her own potential, and that's what we're looking at. What is the potential of every person in the communities that we work with? Also, they can cope with normal stresses of life and live a productive and fruitful life, which is what we're all seeking.
Yeah. I think someone's not on mute there.
Okay. Nancy, I'm going to mute everyone's lines just 1 second, and we'll have people, because we're getting a few things. Just 1 second.
All guests have been muted. You can unmute your line by pressing *6.
Hi, and Patricia and Annie, can you please unmute your lines by pressing *6? And go ahead, Annie.
Thanks. So what we want to do is kind of take this conversation to the next level and look at kind of an approach and shared strategies. If we're thinking about, how it is we're going to be looking at capacity and resilience and looking at multiple forms of violence. And that was one of the things we explored in this landscape report, and we have a link to it in the text chat there if you're interested in it. When we're talking about mental health, we're not talking about illness. We're talking about well-being and what it takes for folks to have that well-being, what their environment looks like. And that's really what prevention is about. I did want to pause for a minute and make sure that we had a shared definition of trauma. I think everyone kind of understands its experiences or situations that are emotionally painful. At Prevention Institute, we also are very clear that we include chronic adversity as a traumatic experience. Discrimination, racism, sexism, poverty, oppression, those things are complex aspects of trauma that are very much included and contribute to things like, we don't call it post, we call it persistent traumatic stress disorder. And one of the ideas we've been thinking a lot more about is actually, instead of calling it a disorder, calling it an injury. And when we think about the concept earlier about innocence and who's innocent, who's disordered versus injured, and when someone's injured, that they deserve healing and they deserve help. So one thing to think about is, the language you use. I think Samuel was talking about language and how important it is, and we agree. And so that's one of the reasons we really think about this as something that's persistent, usually. This goes to kind of Tanya's comment earlier about mental health is not illness. And this is one of the things we found in the report, that mental health is equated with illness, and it invokes the need for a medical model as a dominant approach. But when you think about folks like trauma that are experiencing trauma, it's not necessarily a medical model. And I know, Tanya, you had an example of kind of the experience of trauma that you're going to share from that report and your background.
Yes, for the next slide.
Go ahead, Tanya. You were going to share about the young people and the experience of what it's like to experience trauma.
Oh, yes. So I recently saw this documentary, Wounded Places, where a Stanford physician, Victor Carrion, explains that if we're crossing the street and we see that a truck is coming at us, we can manage the situation, we get scared, we jump and move quickly. I think many of us may have experienced that if you live in urban areas. But unfortunately, for many children in our society, they feel like this truck is coming at them all day long, for more days than not. And this really takes a toll. Think about it. Children living on a daily basis with this unrelenting, continued hammering of toxic experiences and adversities.
Yeah. And I think one of the things we think about is we cue that as an individual problem rather than a predictable outcome of the social context and the physical environment. And I think that's, again, where the expertise between these two groups are really shared, and it's a good overlap. But we understand the social context that makes this type of trauma and violence more likely to occur, and it's in the physical environment. We also have some very specific links, if you're interested, between violence and mental health. And some kind of observations about systems that, there actually is no mental health system in this country for folks dealing with trauma as a result of, experiences or from chronic adversity, that there's no kind of central coordination with that. And as a result, we get this, and this is, I don't have the attribution to this, so someone knows where it came from. It was on my Facebook feed without an attribution, but this is prevention. This is making our case right here. When one door closes, another door opens, and you can see the schools, housing, health, youth, seniors, it's all locked except for those prison doors. And I think that's what we see in a lot of different places where we see violence occurring, and the result being incarceration instead of all these great prevention strategies. The other disservice.
Annie, I think go
ahead, Pat.
Can you hear me? Yeah, one of the things I think that we're talking about is the fact that mentioned the World Health Organization, the Black Health Coalition. We adopted 27 years ago, I should say now, when we started, we adopted the World Health Organization's definition of health, not the United States definition of health, because we really do not, as was mentioned, that we do not have a mental health system. We don't really have a health care system either. We have a sick care system. And that's been historical, and that's still the same way. And not to mention also that our system is not social policy, it's business. When I taught at Marquette University, I taught a course in healthcare, and made it very clear. I told my graduate students that if you don't leave anything else, remember in this society that healthcare is a business. And many of the things, when we try to talk about how do we turn around and do more prevention, what's funded in our healthcare system? It's the sickness. There's not the same amount of dollars, if any at all, until recently. Nothing was funded around preventing. It was all intervening or trying to turn it back around, and that's a philosophy, unfortunately, that fits a lot in how we deal with things, and also even this disconnect between mental health and physical health. There's no, not different. You can't deal with them separate. But that's, again, what happens a lot. No, go ahead.
Yeah, I mean, it's about separating these two concepts. And the next slide, I think, goes to Kenny's point that it's real hard to separate even these two topics of, community violence and sexual and domestic violence. The other disservice we do, besides not offering quality prevention in communities, things that everyone needs to grow and thrive, like schools and health. This is an example of where we had someone that was being victimized, and as they age, we slowly see them transition to being a suspect. So rather than, reaching out, we can see how folks over and over again are traumatized and end up in the criminal justice system as perpetrators. And that this is all, how do I want to say, this is all predictable in some ways. We have the science that backs it up. We know what good prevention is. We know that good prevention solves multiple problems. And so what I'd like to do is kind of switch the tone here for the next 30 minutes and really talk about what we can do. We have all kinds of really interesting opportunities, and I'm going to go up 2 slides here to building community resilience. Yeah, Kenny, let me introduce this, and I'm going to turn it over to you real quick.
Real quick, because when you talked about the mental illness component, I think that we're going to have to find a way to introduce mental illness or mental health to the communities we serve, these challenged communities, in a much more friendly way, because all the barriers that folks have about mental health, denial, the embarrassment, like money, the fear. There's a whole bunch of reasons why the folks that we deal, especially in these challenged communities, do not seek mental health because of the stigma attached to it. So we're going to have to find a way how to, introduce mental health in a much more friendly way where people will kind of embrace it and will go out and seek the help. When you showed that one, that was an amazing slide that you showed when one door closes and another one opens. I mean, every door closes, that just impacts the quality of life in our communities. Every time you close one of those doors, that problem gets dumped into our community, and it just kind of runs the whole quality of life issues a gamut, So I just had to, because those.
No, I'm glad you did. And I think that question is exactly right, that folks are really thinking about, okay, so do you introduce clinical mental health services in a community? Well, probably not, right? Like, that's probably not meeting boys and men where they are, especially if they've experienced trauma, especially back to Samuel's point, if we want to start thinking about, the community of color and their culture rather than, enforcing a white stereotype on folks. We've been thinking a lot about this idea of trauma and the connections between the two at the community level, and we've done a paper on this with Howard Pinderhughes. This is his thinking, and these are some of the ideas that he has to start shifting those. So some of it is at the individual level, but a lot of it is organizational, back to Mira's kind of comment in the beginning about needing to be more thoughtful about how we serve folks and thinking about restorative justice and offering healing circles, reclaiming and improving public spaces where people have been traumatized to, offer a place where people can come together and have something positive. In LA County, they use Parks After Dark for that. And they just bring together the community. They have all kinds of health and wellness services being offered. There's engagement, but it's very healing. So we've got a lot of great text chat going on. And what I want to do is, Kenny, I'm going to turn it to you. And then I'll go to Pat. But in the meantime, if folks want to start texting in, what else is included? I use the title Healthscaping, which is from Tulane, and they make their public health department uses that kind of pun, play on words, for landscaping. So if we want to change our environment to make them more healthy, things that are going to prevent sexual and domestic violence, but also really enhance experience for young men of color, what kind of healthscaping could we do? What else might be included? And Kenny, I'll let you start the wish list, and then we'll go to Patricia, because there's a couple thoughts. What would you want to include? And those of you in the audience, let's get our text chat going.
Well, basically for me, I think that we're going to have to really, really look for more innovative ways to work together, because everybody in certain disciplines, they see what's needed, and they have a lot to contribute to healing our communities. But until we start working together and not in silos, I think a lot of our community will become healthier because we're working together. I've learned a lot of that working with the domestic violence gang nexus about how the two disciplines that deal with violence can work together and do a great job, whatever they tackle. With the schools, a lot of us got a tendency of blaming the schools, because they're not doing their job. Education is a priority. The kids can't learn if they got other stuff that's on their mind, like stuff that's happening at home or whatever. I think we just got to stop playing the game blame and just try to work with schools to bring more of the services that we have in the community onto the school campuses. Because, values taught at a young age. Kids, both girls and boys, they see how, they learn how to socialize, how we have the street socialization kind of theory going around now. I think that we're going to have to be more innovative and, going into the schools and getting those kids at a younger age with our services, especially with the schools with their budget cuts, and they're just mainly, focused on academics. But we're not teaching kids very much because their minds are somewhere else and they can't concentrate on academics if they're worrying about what's going on at home. Is the mom and dad going to be fighting? It's a whole bunch of stuff. We're just going to have to get these kids a lot earlier. Teach them how to not express themselves in a violent way. Kind of teach them more. And violence, I don't mean just physical, I mean the whole verbal thing, the whole emotional thing, with the whole, even you just brought up the law enforcement. We just had another police just killed the black guy, and he just got arrested. But how do we teach the young folks how to deal with policies and, kind of counter that without being violent and an eye for an eye kind of deal? So I think we're just going to have to look for more innovative ways to work together, especially getting to these schools together.
Yeah, thank you. Patricia, do you want to add a couple ideas here, and then I want to get to some of the good things coming up in the text chat.
Yes, absolutely. I'm back to still to really making sure that one of the things we absolutely have to do is see the community as a source of strength, and that the source, and that they have the ability to direct what they need to do, and then also can take in what other people suggest. But many times that doesn't happen. So clearly, when we talk about community engagement, and I think about the year 2000, I got a call from someone out in Detroit, a hospital that wanted me to come talk about how to work with communities, and this particular doctor was very passionate about infant mortality, and he wanted to get in. He was talking to these communities about infant mortality, but he goes to these meetings, and he asked them, well, we want to work on this, and they would say, well, we need more lighting in our neighborhood. We need our garbage picked up more. And he was just very, that translated to him that meant that they didn't care about infant mortality. Now, they were really more counterintuitive than he gave them credit for, because, and I said to them, I said, well, infant mortality is not only just a clinical barometer, it's a social barometer. And what they're telling you that is they recognize that they need better surroundings for their kids to grow up in and to live. It doesn't mean that they don't believe in infant mortality or think that that's a problem, or they don't care about babies dying. But what they see is the larger issue of control of their communities, that they're a place that their kids can live past being an infant, where they can live in childhood and not have violence. And that was, he hadn't thought about it that way before. And it seems that that's still out there, how many decades later, that people are not looking at the communities for what would you like to see. And so clearly one of the prevention strategies that we do is we get communities, we get community people together, and every time we set up any type of council or task force or whatever, we always have somebody from the community either leading or co-leading that. I'm always impressed by people that think, well, they can't run a meeting. Well, a lot of people who run meetings can't run meetings either, but they can learn it. And they do great in terms of setting their agenda on what makes sense, and you're going to get 90% out of what they want to have, and you'll get what you need too, but often that's not the case. So clearly there are communities that need, we have a population density within our inner city that is unbelievable in terms of the number of people packed into 3 and 4 families and houses, but our policies still say we're only going to pick up garbage cans once a week. And so our community is like, well, that's impossible because we got maybe 12 people living in this house. We need more than one garbage can, because that's also what they did about 10 years ago. They took away the ability for you to buy your own garbage cans, and they said you got to use the ones by the city, but we're only giving you one per household. To me, that's an example of how policies really impact the lives of people that they don't understand, and in terms of what they need. And to believe that you can equally spread resources doesn't work. Well, what's going on, more resources have to be provided to the communities most in need, but not just for services, for living. They can. You know the difference that I'm saying?
Yeah, I mean, no, that's exactly what that's exactly, I mean, you can't encapsulate that example better of the difference between equality and equity, in that it's not about everyone getting the same thing. It's about folks having what they need to grow and thrive. And in communities that have been disenfranchised for many years, like Black Lives Matter is saying, we need an investment in jobs, education, and housing, not equal to everyone, but to get us to equality, right? Like, and it's going to take more than where places have had an investment, because there has been such a divestment. I want to get to some of the comments in the text chat here, which is fantastic and really in-depth, considering this is a text chat, getting to some of the comments and affirming the pieces that, you know, this is about disenfranchised communities. This is about humble guidance and access. David, Tanya, anything that you're picking up here as themes in this text chat? And if you all are speaking, you're on mute. So
on mute. So I'm recovering from a cold, so you're avoiding me coughing in this. So, you know, Annie, this is just, I think, a really vibrant conversation about, and, you know, I really appreciate, I think, Patricia's framing of the issue of really building on the strengths of the community and having a policy coming from the community, and I really see that, you know, of driving that and really looking at what the actual impact was. And while I'm sure there was a land use issue on why they put only one garbage can, they weren't looking at the impact from the community.
Yes, Annie, I looked at a couple comments where they brought the idea of working with faith communities and also utilizing the wisdom that exists already in communities to be able to address these issues.
And then it's also important in communities that we understand the intergenerational. That's also where you have strengths, the intergenerational. Some of the infant mortality initiatives that's gone on in Wisconsin, especially in Milwaukee. Well, we just want to talk. They just want to work with women of childbearing age. Well, women of childbearing age live in families and they live in communities, and if they live with grandmas who been through it, a lot of the wisdom and a lot of the fussing that they get, I call it fussing, we fuss in the Black community, fussing, that they get are from people who have gained a tremendous amount of wisdom. And I've seen too often where agencies will come in, especially working with teens who may have gotten pregnant or whatever, that feel that they know more than what that person that they're living with. And actually, one of our teen pregnancy programs actually almost got shut down because they were really telling the teens not to listen to the adults in their families. And that clearly tells you the disregard. And I was reading some of the chat when they talk about how do you get people to understand that they have to be respectful and respect how people live their lives. And certainly within the African-American community, a teenager who's pregnant is still a teenager. That is not an adult. And we actually had some of them, more health professionals than maybe others, but telling these teens that literally, well, you're going to be grown now because you have a child. No. They have a child, they're going to have a child. That doesn't mean that they're grown, and it certainly doesn't mean that, and interesting enough, they're like, well, you shouldn't listen to those adults in your home, but you should listen to us. So what does that mean in terms of, you know, that connotation and that it's basically telling them that there's nothing good about your family no matter what's going on. And so it really is important that we respect, and we're talking about the lives of, we respect the people in their homes. And getting into specifically about looking at African-American men of color, African-American men and boys, that probably, and we don't want to get into the game of who's been treated the worst in this country, because everybody could have dibs in on that, but in the day-to-day lives of African American men, what happens with them. And in Milwaukee is the most segregated city in the country. It's about fourth in poverty. It incarcerates more black men than any place else in the country. Casey just came out with a study that said that Wisconsin was the worst place for black children to be raised. I mean, these are realities of the life there. And for black men who are trying to help their families, and if the metrics that's used, that the best father is someone who can provide for their families, many black men lose out on that metric, and they begin to believe that about themselves. The whole issue around, I was thinking about the whole issue around Black Lives Matter. They're telling the country Black Lives Matter. Many black men and boys need to understand that Black Lives Matters. So when people ask me about black-on-black crime, I equate that directly to internal racism, where you take on the persona or the narrative that's been written about you, and you start to believe that. And so then anybody who looks like you doesn't matter. And so it really becomes extremely important that dynamic turns around. And I'm going to give you one quick story, is that because we provide educational sessions around historical trauma and educating black men and boys around 400 years of oppression and why it's where it's at now, and especially running off some of those metrics I gave you about Milwaukee. The person, Jim Addison, who runs those workshops and explains that, he said he just saw, and he was at he was at the college, the technical college, and he looked at one of the young men because he thought he was going to cry, He said he just kind of stopped and just asked him, hey, kind of what's going on? And he said that looking and learning all this, that he felt so bad about what he thought about his father, because when his father tried to explain to him how hard it was to get a job, how hard it was to keep a job, he just thought, well, that can't be, because he sees people working, so he just thought his father didn't want to work. And he said that he had to go home and apologize to his father for not understanding, what's going on in that community and what's happening in that community, and that it really is hard for black people, especially black men, because they will hire black women before they hire black men. So for black men to get a job, if you understand what I'm saying.
No, I think absolutely, and the text chat is echoing kind of that sentiment about jobs and racism, and how do you do prevention in a culture that's toxic, and that's one of the reasons I titled the text chat Healthscaping, right? Like, some of the initial suggestions in the text chat were about social-emotional learning in school, and that's right. We do need to have social-emotional learning in schools, and we can't forget how important environment is, school climate connections to school. These are all pieces of it where we're changing the environment. And again, we're doing it in ways that prevent sexual and domestic violence, but also specifically support the needs and the trauma and that reinvestment. In our analysis, we came up with 4 kind of initial, very concrete places that there's an overlap. So again, I'm no expert. Prevention Institute is not an expert. We're here having a discussion. But we wanted to give you some 4 very concrete places to start. And this goes back to Kenny's comment about innovative ways to work together. Making sure that mental well-being is connected to community-level approaches, that we're not just looking at individuals, but again, that healthscaping kind of concept. Connecting to men and boys, making sure they're included in our work. And then reconnecting to cultural identity and expanded notions of masculinity. Again, really important in sexual domestic violence, also important to thinking about that trauma and that lens that you're speaking about, Patricia. And that last one is connecting systems and institutions to mental health and well-being to each other, which really goes to Kenny's comment, I think, about schools and some of the text chat pieces, too, about how do we break down our silos and think better together. I'll do a quick poll because this audience is focused on sexual and domestic violence. So if you're not sitting at your keyboard, head back over there really quick. I want you to look at these 4 and ask yourself this question. Don't go to the next poll. Don't launch the poll yet because I forgot to retype the answers. So let's go ahead and launch a feedback poll in the bottom left, but don't move the slides forward. What I wanted to ask you all is how many of these strategies are you already engaged in your organization? And type A if you're not there yet, if you're not doing any of these 4 strategies. Again, there's a feedback poll in the bottom left, so click on that little poll. A, if you're not there yet. B, if you support the work of others in 2 or more. C, if you jointly lead or you lead 2 or more. And D, if it's 3 or more. So I'll repeat those options. A, if you're not there yet. B, if you're supporting the work of others. C, if you're kind of leading in your work or jointly doing 2 or more. And D, if you do 3 or more. And the feedback poll is moving in the bottom left. Again, don't use the text chat. You can go ahead and move right there in that feedback. Can you share the pie chart so we can see it moving? There it is. And just as I suspected, a lot of you are already doing these strategies. So about, let's see, in the A category, if you're kind of not there yet in your organization, we have about 16% of you, so that's great. Hopefully these are some really easy entry points to thinking about these linkages between these 2 fields. And then with B, kind of already supporting the work of others, which is a really great way to start thinking about joint strategies. There's 40%. And then those C and D where you're actually doing this work, it looks like we've got another 40%. So part of this is, prevention, good prevention solves multiple problems. We're probably already doing some of this work. And it's about being a little bit more intentional perhaps and thinking about who our partnerships are with. To do this. So thanks for bearing with me on that slide. The answers were right here, but I forgot to put the questions. I'm not a good epidemiologist, quiz maker. Real quickly, before I turn it back to our guests, I wanted to share the Connecting the Dots, and we actually have a web conference on this, and we have a link to the document because I wanted to ground this conversation in science. We have amazing community wisdom here. You have lived experience. You have work experience, and sometimes our funders require scientific evidence. So I went ahead and pulled that for you. This is a joint publication from CDC and from Prevention Institute, and what we've done is summarize risk and protective factors for multiple forms of violence. So if you're interested in those 4 areas, if you want to do some more work on these linkages, you're already probably doing this work, here's the science that's going to back up why you're doing it. The report is much more extensive. I pulled some ones that were specific to these kind of 4 what is needed buckets. Norms supporting aggression, harmful gender norms, community violence, lack of economic opportunities, low neighborhood support cohesion. Those are all connected to teen dating violence, interpersonal violence, and sexual violence. On the top categories, you see TDV for teen dating violence, IPV, interpersonal violence, SV for sexual violence. And Kenny, if this is interest to you, youth violence is also on there too. So you already know the connections there, but you can see how they're all forms that impact multiple forms of violence and would also be, we think a real important starting place for some of these linkages. We have in the document all of the citations. I want to give you another couple that I pulled, neighborhood and relationship protective factors, so coordination of services among community agencies. You can see that's there for IPV, social isolation, community support and connectedness. I mean, to me, this goes to the big kind of mantra of Black Lives Matter. Like, we need to be included. We are relevant, important, contributing, equal partners in community, and yet we don't have access to the basic things needed to thrive. And I think that's a really important message, and also something that's connected with sexual and domestic violence. So,
and Annie, I just want to make sure that understanding that even you talk about violence, we live in a violent country. There's all kinds of violence that's going on all the time. How it may get exhibited may be related to the risk factors you put out there. But as you look and see what's going on in colleges, what's going on and with people who have money, all this kind of stuff that goes on, it gets covered better because they have the ability to have resources. So I think it is important that we don't, again, think that that communities that may have a lot of problems, that it also means that there must be something, and I'm not saying you say that, I'm just putting that out there.
Mm-hmm.
But I think that's inherent in those folks because of the way they live. This is why they act like this. When we got people all over this country, irrespective of class, irrespective of race, doing some of the same things. So it's really talking about trying to decrease violence is to try to work with our norm. I mean, look how we can't give up our guns. I mean, no matter what, right? Folks got it, it's our Second Amendment right, people will say, but look what happens now. So I just want to put that because I sometimes communities that are impoverished or communities, especially communities of color, people look at that and they don't see them, other people don't see themselves, and then it gets tagged to, it must be, those people, it must be something to do with their culture, or it must be something to do with they're just being poor. So I just wanted to emphasize that we need to understand that we're kind of a subset of a larger problem in this society that we live in that that has a problem with respecting women, respecting people, period. Problem with how you deal and what women will do to get ahead, as they say. That she must have done something to get that. That it's that whole image and language and how we look at Americans and who we are as living in this country, the ones that really end up in prison or in mental institution or something like that, when there's behavior that's going on all over. So I just wanted to say that.
No, I think that's important. We've actually had quite a few really interesting. I see Dalila Butler in our audience today. She was one of our guests for our conversation about health equity and sexual and domestic violence last year, along with Dawn. And it was one of the best conversations I think we've had on Prevent Connect, really specifically looking at that and that how it's not a function of culture and how we can change our organizational practices to be more reflexive to that. So thanks for bringing that up. I think that's important. Let me give you some specific examples of some sexual domestic violence efforts that kind of also tie in. We want to kind of concretize this. So under well-being connected to community level approaches, social emotional learning curriculum, sure, that's one way to do it, but why don't we just change a whole environment? This is a thing called Family Place Libraries. It's national. This is the librarians in Chester, Pennsylvania that have transformed their library to be a family place. And so it's about social connections. It's about welcoming people where they are. And what they do is they have activities, intergenerational activities. For parents, they also have books labeled by all different types of parenting. It's the things that everyone needs to grow and thrive. It counters some of the social isolation, which is a risk factor, and promotes protective factors such as community resilience, connection with others, and it provides a safe place, an oasis, if you will, in order to do that. That is accessible to everyone and doesn't have a stigma. I have some pictures. I didn't want to wait and introduce the guests at the end, so here's some pictures from Wisconsin, and we can go back to them in a minute, but I want to go ahead and talk about connection to men and boys here for a second. Another example in Boston, Massachusetts is the Halls. If you haven't seen this, it's a great tool for some discussion. Again, much more dynamic than a state curriculum because they're thinking about, norms and masculinity in a much more complex way. They're able to explore it through these webisodes, and they have guides online. It is written by teens, for teens, and so, again, it's not something that the Public Health Commission has put on someone else. They actually facilitated it through some young people in their community. With Reconnection to Cultural Identity and Expanded Notions of Masculinity, this is hot off the press, brand new. Multnomah County, Oregon has just adopted the Coaching Boys into Men curriculum, but they've done it universally in their sports programs. And I saw a comment earlier I wanted to lift up in the text chat about how when you move your work ahead of the leaders in your community, your work isn't able to be sustained. And I'm paraphrasing there, but it kind of leaves folks brokenhearted. And I think that that's absolutely right. We always say at Prevention Institute, you need those three. You need community to hold the leaders accountable. You need those staffing folks, the ones that are doing the work, and you need some high-level leaders because they're the ones that can change policy and make these programs sustainable. And that's what they've done in Multnomah County. This picture is the mayor, the school superintendent, and the public health folks, all talking about how important it is that as folks are engaged in sports, they're also thinking about how we coach boys into men and their commitment to offering that as part of their work. So I wanted to highlight that as an example. And then Homeboy Industries here in LA offer teaming ceremonies, and that has come up quite a bit here in the text chat too, thinking about how we take assets and culture and make them part of our resilience work. And Tanya, you had a great example here.
Sorry,
Tanya,
I was muted. Yes,
you'll get the hang of it.
A colleague of mine, a Latino elder here in Oakland, Ricardo Carrillo, often uses the expression "la cultura cura," which in English means culture heals. And we focus a lot on trauma-informed care. His work focuses on healing-informed and culturally specific approaches. I know someone from the Tongan community, I'm sorry if I'm pronouncing your name wrong, is Malofhifu. You have some questions about that. There are other groups practicing the same thing. You know, and the work that they're doing is rooted in indigenous principles and practices that oftentimes we disregard or ignore. Across the nation, we're seeing a lot of great work being done with Latinos and healing circles, you know, connecting men to the wisdom of these indigenous practices, and creating a healthy and positive version of masculinity and what a man is. I really believe that this culture-based healing is linked to restoring one's true cultural identity as the foundation of well-being for individuals, families, and communities. I know Colleen Reynolds also had some comments in regards to culture in Alaska, indigenous culture in Alaska. So great examples. Thank you.
Yeah, and as Patricia pointed out, that every culture has examples of resilience and healing. It's about making those as organizational practices part of what we allow space for and what we allow support for. And Kenny, I wanted to give you a minute too to chime in here. As you're hearing these examples, how does this resonate for you? It's based on your experience working primarily with young men of color that are experiencing trauma and experiencing violence, for 20 years or so.
Well, this all just right up my alley when we talk about trauma and violence. And I'm just reflecting on some of the conversations earlier when we had this Black Lives Matter, and we got this whole nationwide push on Black Lives Matter. And then when I look into our community, especially with the gang culture, we have black on black violence, brown on brown violence. I mean, we just had 3 shootings last night, African Americans shooting other African Americans in this gang war, and we had the same with the Browns. So it just amazes me. We're trying to make sure our folks are more proactive, because people of color has been in survival mode for so long. Some of us don't know how to be proactive with our lives. So that's something that we're really, really looking at. Just introducing the mental health and well-being, even to our service providers, because we could easily be victims of vicarious trauma if we don't take care of ourselves. So, we have to also look at ourselves when we do this. I have to make sure my guys, I have to debrief with them every time they go to a murder scene or they're dealing with families that have been killed. So the trauma even reflects on my guys. Every time I have to, deal with a murder, or my guys have to deal with a murder. So that vicarious trauma, we even have to look out for ourselves. Just educating, re-educating our youth and young adults. That has to be done, because as we know, the human life has really, really depreciated. We're talking about, people could just go out there and take a life and nobody blinks an eye anymore. When a young person grows up into a household and see their parents beating up each other, the human life has really depreciated. So I think we're really going to have to re-educate or educate our young folks and our young adults, and kind of, raise the value of lives. Exposure. Yeah. We have to do a lot more exposure. Our young folks don't get that much exposure. So, You know, we have folks that are in this 4-block mentality. They just see the world, what they see in their 4 blocks, and they're scared to venture out. They're scared to venture out of their comfort zone. But that's not only physically, but even mentally, you know.
Yeah.
Tim,
what you're saying, Kenny, it reminds me of what Vice President Biden said at the Futures Conference a couple of weeks ago. And David's going to laugh because I can't stop talking about this speech, and everything somehow relates to it. But he said, don't tell me you support violence against women. Show me your budget. Don't tell me you care. Show me your budget. And to me, that relates right back to what you just said about these young people not valuing themselves and not valuing life. Is as much as it's important for us to tell young people, especially young men of color, we value them, we have to show them with our budget, show them with our practices, the way we do our work, much more than, telling them what we do. And one of the great examples here is in Minneapolis, and instead of locking kids up for truancy, they're saying, hey, what's going on? They're treating that as a symptom of something greater. And they're saying, what's been happening to you? What's happened to you? Rather than, this is the consequence for your action. It's important to hold folks accountable, but it's also important to start exploring that, what's going on with them if we really want to do quality prevention. Culturally relevant approaches to mental health. This is a really important piece of the Affordable Care Act, which I think folks have kind of mentioned. Patricia mentioned that, the landscape was changing. There's a great New York Times article on that if you want to go deeper. The last thing I want to share with you as we wrap up today, and thanks for sticking with us, our numbers have only increased through the hour and a half here. That says something to the quality of the text chat and the discussion and our guests. This is Marin County. We just recently did a strategic plan with them. And when I was looking at the four things that they chose, connection to a caring adult, respectful diversity and emphasis, community connectedness, and skills in solving problems nonviolently, I said, well, here's the overlap. This isn't something that's a stretch for us when we think about the connections. This is something about just being a little bit more intentional about what we're already doing. There's 3 goals, and again, this is the Public Health Department in Marin County in California. Cultivate a connected community, unlearn the culture of violence, and engage at the first sign of risk. Really core values that are supporting both of these movements, not just moving towards equity and respect for women and girls, for relationships, but also for men and boys of color. So as we wrap up our time here, Patricia, I wanted to give you the final word, and our text chat here today. I just want to thank all of you for texting in and being so thoughtful about your comments. This is not an easy topic to discuss. It's not something everyone's comfortable with, and I really want to appreciate your vulnerability and your sharing today. What's one thing you want to remember for today's discussion? That's a really nice way for us to summarize some of the most important points here today. There's a lot of quotable moments. And as that's kind of filling up, I want to give the floor to Patricia for a final comment. She shared the slide, and maybe, Patricia, you can kind of wrap us up with why you chose the slide and kind of your thoughts on the topic here as we end our time together.
Well, I think this slide really speaks to, I've been reading the chats as well, and some of the saying is that we have to do these things for ourselves, that we can't keep asking people who are not of color to do this for us. But being, like I said, having defeats, but being defeated. I mean, Maya Angelou was wonderful in those kinds of things, to understand that in some ways you are in a war. You may lose one of the battles, but you don't have to lose the war. And that comes with understanding that you have so much more to give, and appreciate who you are. And that's why we have to take, I'm not saying take back, because I think many people, and I speak for the African American community in terms of that I live in. It doesn't mean I still know everything there, but I think it is important that even when you do men of color, there's different things you have to be respectful of different populations. And I think culture has to be seen as a positive asset, and not I hate people talk about cultural barriers, and I'm always confused about that, because I think what do you do with barriers? You break them down, which means you don't have respect for that culture because you think you know what it should be. I think it's going to have to be, in real time, it's got to be a step back. The majority of people who work with communities of color are not people of color. because that's not where the money flows many times. So when you're talking about getting to the policies and funding, some real down to the real sources, that more of this money needs to go directly to the communities so they can deal with garbage and deal with poor places for their kids to play, and not have other people continue to be very blunt, make great money and great careers off of what's happening in communities that need some help.
Oh, David's pointing at me and I'm pointing at him.
I said everybody, you didn't hang up, did you? Everybody didn't hang up.
You closed it better than any of us could. So thank you. Let me turn it over to David. You and Kenny, what wonderful, wonderful guests today. Oh, you set the tone. You raised the bar high.
Well, I want to thank Patricia and Kenny for joining us, and most of all, I want to thank all of you as part of the Prevent Connect community for a discussion for us to be able to explore this. And the continuity of these discussions, we build on them. We're going to use this to work on our next pieces. We invite you to join us for future conversations as we move forward. Thank you, Patricia. Thank you, Kenny. Thank all of you. Thank you to the whole team at Prevention Institute. This is what their building looks like. And thank all of you who are part of us, and we hope you join us on future Prevent Connect web conferences. We'll leave the text chat open for another few minutes, but this concludes the piece. Presenters, please call the passcode, this phone number that you just did with the other passcode, so we can do our debrief session. Thank you. This concludes the audio portion of today.